Dr. John Torres with NBC Nightly News on this Facebook Live, answering viewers' questions. So if you have questions, please look at the comments we set out there. Go ahead and send me your questions. We'll get to as many of those as we can. But first off, I want to answer one of the questions that I get probably the most out of all the vaccine questions, and that's about the vaccine side effects. And most questions people have are, can you get side effects from the vaccine? And the answer is yes, but that's a qualified yes. Because what happens are, with most vaccines, because it's revving up your immune system is going to give you some side effects. Those side effects are usually minor, and that's what the Pfizer vaccine, since they've released the data, is showing. What they're finding out is, for the most part, these are minor side effects, but the majority of people tend to get these side effects. And looking at them real quickly here, injection site reaction, 84% of people, fatigue 63%, headaches 55%, and muscle aches 38%. Those were the biggest complaints they had for side effects. They didn't detect any adverse side effects, as in huge significant ones, but these were the main ones. And again, this is more your immune system kicking in, causing these reactions, which is what happens when the immune system starts revving up, and that's showing that the vaccine is actually working. People also said that these side effects usually cleared within about a day and a half. Now, there were reports of 4 people getting what's called Bell's palsy. It's a neurological condition that affects the face. Of the 4 people that got it, they were people that were in the vaccine group, not in the placebo group. But statistically, it's what they call statistically insignificant, because you can imagine 22,000 people got the vaccine, 22,000 got the placebo. So those that got the vaccine, 22,000, 4 end up getting Bell's palsy. That's a very, very, very small amount. And that's the amount you'd see in normal society, people who hadn't gotten the vaccine. So overall, the safety looks very good on this data that's been released. And this is the data the FDA is going to use to see if they're going to go ahead and approve the emergency use authorization, which most experts seem to think they will be approving. So let me see if you have another question.
If someone is vaccinated, can they pass the virus if exposed?
So the question is, if someone is vaccinated, can they pass the virus if exposed? Now, this vaccine, the Pfizer vaccine, gives you 95% protection. That's protection from the virus causing COVID-19. The virus can get in your body, but usually by then your immune system kicks in and makes sure that it gets kicked out of the body, so you're not able to build up that load where you can actually give it to other people. And so the good news is, yes, if you get the vaccine, once you get through both doses and you get sufficient immunity responses, you should be protected from passing it on. But by the same token, enough people have to get it to get everybody else protected. If there aren't enough people with the vaccine, and many, many people have coronavirus around you, it's possible they could get you with a heavy enough viral load that it could, even though you had the vaccine, you could still end up getting it. But as far as passing it on, you should not be able to pass it on once you get both vaccines, at least 95% of the people, because it should protect you from that happening.
Should I get the vaccine if I've already had COVID-19?
And this is one of the bigger questions I get. Should I get the vaccine if I've already had COVID-19? Yes, and here's why. Because when you get COVID-19, if you got tested and you tested positive and you know you actually had COVID-19, it depends on the severity of your symptoms, it depends on your immune system, and it depends on how long you were suffering from the complications of coronavirus. Because the more severe, the more likely you are to have antibodies at higher levels. The less severe, the less likely you are. And those antibodies seem to wear off over time. And so what we do know is that once you get that vaccine, it puts everybody on a level plane. That level plane means that everybody is going to have essentially the same immune response to the virus if it starts coming along, and then we know people are protected. Plus, it's going to be hard to look at everybody in society across the country and say, did you have coronavirus or did you not have coronavirus? Did you have COVID or not? Are we going to test people? It's just much, much better for everybody to get the vaccine. They get a known amount of the vaccine that gives them a known immune response that can protect them at a known level. That's important to get this under control.
Do we know the long-term effects, or will they be studied?
So the long-term effects for coronavirus right now, the vaccine is, I'm assuming what the question is, do we know the long-term effects of the vaccine and will it be studied? Well, right now we know effects going on months. We don't know effects going on years because we simply haven't had the vaccine around that long. But looking at what's happening right now is over a 2-month period they were following after getting that second dose. Again, we're talking the side effects I was mentioning early and no significant side effects beyond that. Talking to experts, they say the vast majority of people, if they are going to have side effects, are going to have them in that 2-month period. And so beyond that, it's possible that there could be some side effects, some adverse reactions down the line, but we won't know those until we get to them. But by all estimates, this looks like a very safe vaccine, not just short term, but long term.
Will the vaccine work for autoimmune or immune-compromised individuals?
So the question is, will the vaccine work for autoimmune or immune-compromised individuals? For autoimmune individuals, it should work. Their immune system should be able to kick in and provide them that immunity response, that ability to kick out the virus, and that protection. For people that have immune deficiencies or suppressed immune systems, it might not work as well, because the way the vaccine works is you get the vaccine, it revs up your immune system to attack the virus. If your immune system can't rev up, can't produce those antibodies, can't produce those T cells to try and fight off the virus, then it's not going to be as successful. And so if you do have immune issues, it could be complications of getting the virus. You could get the vaccine. The vaccine itself is not going to cause complications, but your immune system might not give you sufficient protection at that point. Any other questions?
Why do we still have to wear masks after getting the vaccine?
And this is a great question. Why do we still have to wear masks after getting the vaccine? And this is a question I'm getting from a lot of people. And the reason is because we need to get to herd immunity in order to protect everybody. Herd immunity, 70% of the population needs to be vaccinated against COVID-19. By some estimates, it's up to 90% of the population might need to be vaccinated. And what we do know is if you have coronavirus, there is a potential that those antibodies could wear off over time. We don't know what level of antibodies you're going to have. If you get the vaccine, we know you're going to get a certain level of protection that can protect you and those around you. But until sufficient people get that level of protection, we're going to have to wear masks, wash our hands, social distance, those things we're doing now. And so the quicker people get this vaccine, the more numbers of people get this vaccine, the sooner we'll be able to get rid of those masks, or at least not use them as much.
Will the vaccine be free for everyone who wants it?
Will the vaccine be free for everyone who wants it? As of now, the plan is for anyone who wants the vaccine, that the vaccine will be free, administration costs will be free. There'll be nothing to hinder them from getting the vaccine. The reason that is happening is because the government wants to make sure, public health experts want to make sure that everybody has a chance of getting that vaccine so we can get high enough numbers to get that herd immunity I was just talking about.
Is it safe for children?
Is the vaccine safe for children? The answer is we simply don't know at this point. The vaccine was tested on adults 18 and above, both the Pfizer and Moderna vaccines, and the ones following behind them. The Pfizer vaccine has actually been tested down to age 12, so 12 to 17-year-olds. Moderna is starting to do the same thing. We don't have results from that yet, and we don't have any testing on children below the age of 12, so we don't know if it's going to be safe for them. By all indications, and talking to experts, the safety profile in the adults gives them good confidence that it's going to be safe in children as well. But we want to be careful with children, with pregnant women, with breastfeeding women that have not been tested, that we make sure we test it on them before we start giving it to them in the general public.
What happens if you can't get that second shot in on time?
So what happens if you can't get that second shot in on time? Right now with the Pfizer vaccine, you need to get the shot at day 0, the first shot. That is the primer shot. That basically primes your immune system to recognize COVID-19. And then the second shot at day 28. That's the booster shot that makes sure that this primed immune system now has sufficient antibodies to protect you from COVID-19. If you can't get it at 28 days, there's usually some leeway in that. There's some play in that, and you can usually get it a few weeks afterwards. We'll find out when the FDA does its emergency use authorization meeting coming up in a couple days, exactly how long people can go before they are no longer eligible to get that second shot and have to go back and get the first shot again. But typically with vaccines, you have a very long period of time, as in weeks or months, that you could delay that shot if you need to. But the important part is that you get both those shots to get the full level of protection.
Can the virus mutate needing a new vaccine development?
Can the virus mutate needing a new vaccine development? And that is the big question that experts right now think that is not probably going to happen. And the reason I'm saying probable instead of possible is because it's always possible that the virus could change enough to where this vaccine no longer works sufficiently. The flu virus being a prime example. Every year the flu virus changes enough to where we need a new vaccine to make sure we can handle that year's virus. With this virus, since we found out about it back in December, January timeframe, has been fairly stable. It's undergone a few changes, but no significant changes that would make this vaccine unable to take care of the virus. And they think that's going to help long-term and go on long-term because they haven't seen those mutations. But viruses are tricky, and it's always possible it could happen. But as of now, they think this vaccine will last at least a couple of years, and hopefully even much longer than that.
Are there concerns if you have an underlying health condition?
So are there concerns if you have an underlying health condition? And I'm assuming the question is, with the Pfizer or Moderna vaccine, are there concerns about getting the vaccine? When they tested this vaccine, they tested on a variety of ages, a variety of ethnicities, a variety of weights, and even a variety of medical conditions. If you look at the inclusion and exclusion criteria, the inclusion criteria, meaning the people they wanted to get in the program for the human trials, the volunteers, they wanted people with a variety of medical conditions. High blood pressure, heart disease, diabetes, obesity. They wanted a full spectrum of people to test it on them. They have tested on them, and it looks like a very good profile, both a safety profile and an effectiveness profile for people with other medical conditions, especially those medical conditions we know put them at a higher risk of complications from coronavirus.
Are the COVID vaccines safe for children?
Are the COVID vaccines safe for children? We don't know at this point. By all indications, they will be safe for children, but they have not been tested on children. Pfizer and Moderna are both doing tests now on children 12 to 17. Nobody is doing children below the age of 12 at this point yet. There are plans to do them, and the experts I've talked to said they think those plans will move along very quickly, because once we study them on adults, once we find out they're safe in adults, then we can start studying them on children and make sure they're safe on children. That should happen in a very compressed time period, and most experts I talked to say they think by the summer we'll know the safety profile for children, and we think they'll be safe for them as well. But as of now, has not been tested, so this vaccine, adults only.
When will the vaccines be available to the general public?
When will the vaccines be available for the general public? This first phase, phase 1A, the ACIP, the Advisory Committee on Immunization Practices, the CDC's advisory committee, just came out with what they call phase 1A recommendations. And those are frontline healthcare workers and people in long-term care facilities. They'll be the first ones to get the shot. There's an estimate, 24 million of them out there. We expect to get 40 million doses by the end of the year. That would cover 20 million of them, since it's a 2-dose program. And so there's still going to be a little shortfall there. And after them will be essential workers, will be people with pre-existing medical conditions, and then down the line will be those in the general population. By most estimates, the general population, those of you that don't fall into those other categories, should be looking to get them sometime in the spring. March, April timeframe is probably when you're starting to get them, or at least starting to have the ability to get them.
What if you have asymptomatic coronavirus and don't know it? Will the vaccine make it worse?
So if you have coronavirus and don't know it, will the vaccine make it worse? In other words, if you get the vaccine while you have active coronavirus, could you run into problems? The answer is no. And that's because of the way your immune system works. And so your immune system at this point, if you have coronavirus, is already trying to recognize what that is and already trying to fight off coronavirus, already trying to develop those antibodies. That's essentially almost like that primer dose of the vaccine. And so when you get that first dose, it's going to act kind of like a primer and a booster dose all in one. And then 4 weeks later, when you get the second dose, it's going to act like another booster shot. And so if you have it and you get the vaccine, it's not going to cause any complications. It's not going to cause any health effects, but it could actually make your immune system even a little bit stronger, because those two are fighting off, both the vaccine and the coronavirus itself are exercising the immune system to fight off that virus.
What do we know about the coronavirus vaccines and pregnant women?
What do we know about the coronavirus vaccine and pregnant women? At this point, we don't know a whole lot, because pregnant women and breastfeeding women have not been included in the trials for very specific reasons of safety. Wanting to make sure they're safe on adults that are not pregnant, not breastfeeding. And once they figure that out, then again, much like children, they'll be testing children, they'll be testing pregnant women, they'll be testing breastfeeding women. But it does turn out that some women got the shot and ended up getting the coronavirus without knowing. It turns out some women did get the vaccine without knowing they were pregnant at the time. And they looked at them, and what they found out, and let me look here just to make sure that I'm telling you all the accurate information, is what they found out is the pregnant women themselves, even though we don't have data on specific studies, it looked like there were no adverse reactions to pregnant women themselves, the ones that were that got the vaccine while they were unknown. Well, it was unknown that they were pregnant, but they turned out to be pregnant at the time. And so from that very limited amount, it doesn't look like there's issues, but we really can't take any credence off that. We really have to do studies to make sure they're safe on pregnant women, to make sure they're effective on pregnant women and women that are breastfeeding as well. But the good news is, again, in those very, very limited amounts, the ones that got them, even though they were pregnant at the time but didn't know it, it looked like the safety profile was pretty good, But the way science works, we really can't use that for good information. We have to do serious studies on that. And again, thank you so much for your questions. These have all been fantastic. Stay with us tonight on NBC Nightly News. I'll be answering some more questions you might have from this Facebook chat. And again, these questions have been fantastic. They always are the ones viewers get us. I appreciate it. And as always, I hope you stay healthy. I hope you stay happy.